I think we should certainly walk away from this conference, even though it's not over yet, very inspired. But I think also we need a bit to echo what others have said, with a realistic sentiment to say we still have a lot of work to do in figuring out how it all fits together, what would be the best choices, how would it best be applied, what is the research that we need to do to understand implementation better. And also I think we need to also walk away still recognizing there are still 9 million people who are not able to access services and treatment. And even if we get them, if we continue to certainly invest in getting them on treatment earlier, we already also are maximizing not only their own outcomes, but also we're already maximizing the prevention benefit. So that should not be the only thing we do, but while we figure out all these other things through demonstration projects, possibly more research and some strategic analysis, we need to not lose sight on where some of those poorest countries actually are in catching up on some of the previous recommendations that have been made.
So I certainly would agree with everyone and with Tim's comments that we do need an awful lot more work to be done. And I think that from this conference, we need to actually look at translating the information that we've received into something that is actually understandable for countries, but also for people. I mean, Bob mentioned we must listen to the people and hear if they demand it. I must tell you that if I went from this conference to the constituencies that we're writing our national strategic plan with 19 civil society sectors, people would not understand. They would not have the tools to actually understand and weigh up. They would ask that we actually did more interpretation. So it's also up to us to say, well, what have we understood so far? Where are we? We can't ask people at a community level to weigh up this quite complex and nuanced data. And I would say one of the things we should do from this meeting is to have something that also gives some sort of guidance to countries about where we are secure in what we know, where we want to know a bit more from this whole field of data that we've heard, so that it will help people at a country level. I also think that we need these prioritization tools. And I agree with you, we're going to have to think how we do this, but at a country level, countries need to know whether they put all of their bucks into male circumcision or whether they put and we're saying, are we going to now buy 600 million condoms or 1 billion? I mean, it's that level of decision-making around expenditure. So I think that's the second thing we want to do. But the third thing I just want to sort of leave with a thought, I mean, it is this question of can we end the epidemic? You know, I think we're a little bit schizophrenic. Because we do all this modeling, 2031, yes, if we have enhanced prevention, yes, we can do it. We're paying lots of money to modelers, I'm sure there are some in the room, to actually set it up saying, yes, we can do it. But then we all sit here and we say, but we're too nervous to say, yes, we can do it. So I think we have to decide whether we're going to say, yes, we can do it, and it becomes a global strategy to do it. And that was the point about the vaccines. And so we start to articulate that language. Just as we're saying we want to reduce PMTCT, we want to eliminate it. We've been brave there. We think we could get there. But we need to decide at what point we say this, that we've got the tools, the modeling tells us we can do it, 2031 tells us we can do it. At what point do we say as a global community that we actually want to start articulating that as a demand? Because then it becomes an advocacy demand, and it becomes a demand to governments, and it becomes demand to budgets and line items and co-funding and PEPFAR and. If we keep saying, oh, well, we model and it looks great, but we're going to stand back here and say we're too frightened to say it. My question to this House is, at what point do we then say it? If we're not ready now, okay, but at what point does this global community, with all of the conferences we have, with all constituencies, actually say, it's about time we set a target and we say 2031, we're serious?
I don't think I can match that. I think my last closing thoughts would basically go back to all about choice and also the involvement of people living with HIV. I think it gives individuals choice on what prevention tools they want to use. So I think this is exciting, but let people have a choice and have the thoughts of, involve people actually living with HIV. And I'll still go back onto the issue of access. I mean, we all come from different parts of the world where in some places access is not easy, and let not cost be a barrier. And Finally, I also want to advocate for an update in laws that protect people living with HIV, or those who can be prosecuted for transmitting HIV. And finally, I would like to call on further research in terms of what will these drugs do to people who are going to take them, especially tenofovir. I know it's not very good for kidneys, and Africans have a problem with kidneys, so I think I'll call on the scientists to sort of look at what monitoring will be done for people who are going to be taking these drugs. Thank you.
Great. Memory, thank you. Thank you all. Everyone at this table, everyone in this room for sticking through it. I promised you wine at 8. We're 10 minutes late, but you stuck with it. This, as I said at the outset, this is the beginning of a conversation, or it maybe not the very beginning, but it's early in the conversation. I want to just mention one thing, and picking up on what Helen said. A number of organizations, and it was great, Black AIDS Institute, AIDS Foundation Chicago, and IRMA, and Helen's Institute at WITS, and a whole range of other organizations collaborated just after the 052 result in issuing a call that said we can end the epidemic. And it didn't say it as an aspirational vision that just said we can end it, we're done. It said we can end it, and it's really going to be hell of a hard to end it. And this is not the end, it's not the beginning of the end, it's the end of the beginning, and we need to do something differently, as Helen said. And I would encourage you, we have almost 400 signatures of researchers, advocates, policymakers from all over the world, institutions as well as individuals. Please go to endtheepidemic.org. If you don't agree with it, let us know, because we don't want people not to sign it because there's something in it that doesn't feel right. Let's have that conversation, and let's really build that momentum and set some metrics and some targets. And as Tony said, this is a long haul. And I would like to suggest, though, that as a community, we need to set some metrics for success. And I would argue that first and foremost, I'm sorry we didn't get to it now, maybe over wine, what's the storyline in AIDS 2012? What's the storyline in Washington, D.C.? What do we want it to be, and what are we going to do to put us at least one step closer to making this declaration something more practical, more feasible, and slightly closer at hand? Please keep this conversation going for at least the next months, years to come together. Thanks again.